Hello, everyone. My name is Lydia Nguyen. I'm a P3. Miss Herb, she's a P2. We are both interns at the Pittsburgh Poison Center. And our project is a continuation of the work that I started with another collaborator last semester. So a little bit of background of how we started up this project. Our director of the Poison Center, who's also Pitt faculty, Dr. Amanda Korenoski, basically approached me as an intern, as also as a person being involved in the pharmacoeconomics club, asked if I was interested in starting up special topics about justifying the need to modernize the Poison Center. So if you guys aren't aware, the Poison Center is a 24/7 hotline that both the public and healthcare providers can use with anything toxicology, whether that be medication exposures or household exposures. So we went into this with a very broad concept of how can we justify to modernize the Poison Center. And since then, we've come to more narrow our scope, and our ultimate goal is to evaluate how patients prefer to seek health information and how that relates to Poison Center utilization. So, as I said, currently the Pittsburgh Poison Center covers about half of PA, most of Western PA, in collaboration with the Philadelphia Poison Center. And but in recent times, some other poison centers across the country have started utilizing other communication channels such as chatbots, text, SMS, things like that. So our project objectives was basically to determine whether the Pittsburgh Poison Center could be reaching more patients if it offered alternative communication methods, and therefore justifying that need to modernize. And so through our project, we hope to determine if there are any alternative communications and which one would be best to serve the Poison Center. Hi, I'm Kaiya, like Lydia said. So, Lydia started this project last year, and I didn't start interning at the Poison Center until like last April. So I kind of like gathered all my experience over the summer. And then she asked me to join a project with her, so I'm really happy to be here. And another focus that we've been looking into is there seems to be a gap between like callers age like 18 to 28. And so we're kind of looking into why there's that gap. So throughout the semester, we researched some past literature from other poison centers to help formulate survey questions relevant to that research goal, trying to figure out why there's this gap in this age group. So for this survey, we have formulated a big group of questions, and we started to narrow them down. So with our survey, we want to understand how residents of Pittsburgh and the rest of Western PA prefer to interact with health services. So whether it be like chats, texts, or if they prefer the calling system. We also want to understand how Pittsburgh residents interact with those chat-based systems. So I'm sure you guys also get like text reminders, whether it be like your pharmacy, your doctor, appointment reminders, stuff like that. And then understanding what scenarios of exposure influence people to reach out to the Pittsburgh Poison Center. So if it's like drug interactions or, like how much of a household exposure will have them want to reach out to us, because there seems to be a lot of gaps. And then we also submitted our abstract to PPA and APHA, and this is going to help us share our future findings with the scientific community and educate others about the Poison Center services. So for next semester, we are going to distribute the survey, collect our data, and present our findings at PPA. Just big shout out to Dr. Patel for guiding us through this, and Dr. Amanda Korenoski for being both our director at the Poison Center and giving her input as a stakeholder. This project has been valuable for me as like my first research experience. So really going into the nitty-gritty of how do you narrow your scope, how do you write an abstract, things like that. So it's been a great opportunity all around.